Thank you for staying with us. Now, over the past, from last week into this week, we've been talking about health and technology, and that's something, technology is something I love, and you can't say you love health. Health is us. You have to be healthy to live, of course. I have Dr. Oluwe in the house. It's great to have you. You're welcome, sir.
Thank you, Mr. Mike. How you doing?
I'm good. And you?
I'm well.
Okay, so today we're talking about using technology to correct your posture and all of that. Yeah, so what exactly are we touching on today?
One of the, when you build a house, you start with a foundation.
Okay.
So that without a solid foundation, the house comes down. So also as our posture. When it comes to our health, our legs is our foundation that carries everything.
True.
So now when our posture is out of order, we tend to have all kind of problems. Muscle imbalance, neck pain, back pain. We tend to age faster. We tend to develop arthritis because of muscle imbalance. So how do we fix this problem? We don't know. Thank God for technology. For technology. So we have this technology, which will be flashing on the hair to see the result of the test. Okay. We can put you on this machine, and this machine will go through your body like a scan. We scan you from head to toe, and we spit the result out for us in about 2 minutes. And it will give us your body balance, it will break your body into segments and tell us what is going on.
This is what we used to see in movies some years back and all that. You just put it to something, scan you, and then tell you and all of that. It is possible now.
It is in Nigeria as we speak.
Wonderful. Wonderful. So let's take us through that process. What happens? Is it an app used on your phone? Do I have to come to a physical center to visit you?
Yes, you have
all
to
of that?
come to a physical center because it's a very cumbersome machine. We have to put you on the machine and set it up and have a scan of your posture. So it begins with your foundation. So we look at your foundation. Our legs is made up of 3 main arches. The arch is what supports our posture. So when these arches become collapsed, then our body begins to take all kind of shape. People begin to have arthritis at a very early age. People begin to have pain, neck pain. And it's been documented not only in the Western world that about 59% to 60% of the reasons why people are not coming to work is because of terrible back pain or neck pain. And of course, that's food for our orthopedic surgeon, and we're not competing with them. We just want to slow the body down from aging by helping the body, showing the body what the posture abnormality is, and correcting it. And now, the good thing is that there's a solution.
Exactly. I was getting to that, the corrective measures. Now, just before we talk about corrective measures, are there some preventive measures first, before we go into corrective?
Well, the good thing about it is knowledge.
Okay.
If we don't know what is wrong, you can't correct what is wrong.
You're right.
So what we tell you, what this technology tells us, it tells us how our body is, how our body frame is. So this machine kind of takes out all the skin and show your bone. Because most of us, we tend to feel that everything is okay. But this machine takes us to the bare bone, scan our bone, and we can even see a result right there. That's somebody's posture right there. So once we get this test, it shows your posture, and then we begin to tell you what is going on. It tells you, this kind of a person is already having pain on the right shoulder because there's a right shoulder's drop.
Yes, there's some sort of imbalance there.
Exactly. And that person right there, we didn't even tell us that he's having leg pain, left knee pain. But the moment he came on, and he said, you know what, I've been having pain in this leg, and I don't know why. So for this person can easily get into early arthritis because the weight distribution is not balanced, and that is where our problem is. So we have this saying in medicine: every man is crooked. You just have to find out where your
crookedness lies.
Yes, and we begin to fix that crookedness. And without the foundation being solid, we can't help you. So once we fix the foundation, then we begin to tell you what the corrective measures are, what exercises you can do.
Exactly.
And
so we have exercises. That's what we're going to now.
So we have an app that comes with all of this called Dr. Connect. We have over 100 exercises in there that can help you strengthen your core muscle, your body muscle, your body on the overall, And once these muscles are strengthened and we put the corrective measures in place for you, then you begin to live a very active life. I can tell a lot of people say, I wish I can have massage on my shoulder. I wish I can have massage on my back. It's because the tension on the muscle is increasing by the minute because we have our posture out of whack.
Those massages, do they help?
Well, they provide temporary release. No matter what,
temporary relief.
Exactly. No matter what you do to muscle, once you put a pressure on the muscle, they relaxes, you know, and they give you a comfort for about 30 minutes, 1 hour, depending on how deep the massage is, and then the cycle continues again.
So now, what can we do in those kind of situations now? You said there's some kind of exercises you can tell us now that, like you said, from the foundation, so that means a lot has to do with the legs.
So now, before you can correct the problem, is somebody who has a short leg. You know, for you to correct that person walking better, you have to put some certain things in the shoe. To make sure that the leg becomes balanced again.
Okay, yes.
Then you begin to fix the problem. So we have technology that can prescribe some kind of an insole that will correct that posture. And once we put that insole in your shoes and you begin to work with them, then we begin to correct your problem from there on. And then we can come back. You can come back. We can give you exercises to do at home on your own with that.
Okay.
And I'm telling you, within a month of putting that guy's putting the insole for the guy, his life dramatically changed. Pain went down. Use of narcotics, medication went down because
painkillers and all of that.
Exactly.
Now, okay, so all of this is available via the app. It's where you can start from, right? Is that where
you can download our app called Dr. Connect? Once you connect with us on that, you can even book a test like this. This is one of our tests that we do, but we're just talking about this today. So you can book a wellness. We do a wellness plan whereby we check a bunch of things. We check your body composition.
Yes, talking about body. What we see here now, this the posture. Now, we've seen a posture where it's bent, and then we see some pressure points.
Yes.
Where you've pointed out the neck, the low back pain, the knee pain, and all of
ankle,
that.
yes.
And then this shows us correct posture. So it says whenever you are standing, you do your best as possible to stay up straight.
But with the guy on the other side, you can see under that foot right there.
Yes.
There's something right there. So that is the corrective measure that
helps that person to stand well.
And that is because when your heart collapses, it's gone. There's no remedy. We have to put an outside corrective measures to balance that. Once we balance that, then we can align your body again. Once your body is aligned again, we can begin now to retrain your muscles to get used to what normal is. And when we restore your muscle memory, back to normal, then you live a pain-free life.
Wonderful. So now I understand when you said from the foundation. Once the foundation, the soles of the feet. Once you can get that right, a lot of other things.
If the foundation be destroyed,
what can we do? Wonderful. Thank you so much, Dr. Olowe. This was quite an enlightening discussion with you, and hopefully this is something that has come to stay and something that people can use to help themselves.
Well, thank you for having us. We are very grateful for this opportunity.
Thank you,
Nigerians, we can fix you now. We can make every Nigerian from crookedness to wholeness.
Wonderful, wonderful. Thank you so much,
Dr.
Olowe.